complication. So first of all, we have to know what is the definition of the fillers and the complication. For the fillers, actually from now at the southeast of ER, from fill to be the filler from word to now. So anything that can fill, whether you fill the face or fill the road is what we call filler. The categorization of the filler can be divided into the duration of action, mechanism of action, and also the source of the fillers. And for the complication, this is a definition from different sources of dictionary. There are some differences in details, but to say frankly, there's two main key points for the definitions of the word complication. First, is it something unexpected to happen, and second, is something that have to follow the first primary event. And normally I categorize the complication into the local one and systemic one, combined with the onset of action. For the local complication, we divide that into the early and the delayed one. And systemic complication, you have to keep this in mind. It do not happen quite often, but it is life-threatening. It's like anaphylaxis and angioedema, like this and like this. Okay, so be prepared. Always keep adrenaline in your office. And it is undeniable that vascular complication is one of the most frightening for the injectors. This is the blindness that happened in my country a few years ago. And this is a study published in 2013. You can see that this is the area, the blue one is the necrotic complication, and the red one is the visual complication. This is the study in 2015. You can see this is the blindness area, it's around here. And this is the other study published this year. You can still see that the majority of the distribution is around granular complex, nose, nasolabial fold, and forehead. You can see this from these different publications. The trend is still the same, that the majority of the distribution for this kind of application is in the midline of the face, like the granular, nose, forehead, and nasolabial. That's why the complication of the vascular and the blindness has been reported more on the Asian side of the world, because normally for the Asian, the mid part of the face is less developed than the Caucasian one, right? So we know the procedure in this area more frequent than the Caucasian. And the culprit agent first is the fat, followed by HA, published in 2015. This one published this year, also the same trend, first is the fat, then is the HA. And this is the blindness from the fat to, and this is the fat in the optic vein. So therefore, sometimes of the periocular complication follow the injectables. Type 1 is blindness without ophthalmoplegia or ptosis. Type 4 is blindness with both. And normally for the VA, it does not improve much, but for the ophthalmoplegia and ptosis, the prognosis is better. The reason behind it is very obvious, because the retina is less tolerant to hypoxia than muscle. And from this one, I think you can figure out how the blindness can happen from injecting in every single area of the face. All the vessel is communicated. And this is the real case that has been referred to me from the colleagues. This case, the patient requests the doctor to do the injection to treat this depression which is congenital. The doctors do the sharp needle technique on the bone. Deep injection with only 0.05 mils of the product, and this is the result immediate after and 1 day after. and focus on the periocular area and the forehead. You can see the distribution of the problem. Just a single drop here can cause this problem. So interesting point from this case. I think you all have known that normally we have to be careful when do the injections in the area that have previous accident or the surgery. But I would like to add another concern. If you want to treat the patients with congenital defect, it can cause higher risk. Because this is not the only case that has been referred to me from the congenital defect correction. There are the case in the other office that cause the blindness from congenital correction of the forehead also. And also, the other one is feeling the needle hitting the bone. This means no need equal to really hitting the bone. For example, let's say the diameter of the supratrochlear artery is around 0.7 to 1 millimeters. What will happen if the length of the bevel is so long? Okay, you can feel that you hit the bone, but it's the tip of the bevel, not the whole hose. So what will happen in this case? This is another risk. If you use the needles with the long length of the bevel. And this is the study from the engineering faculty regarding the way we should do the pediatric IV assays. But we can apply to the aesthetic side. For the pediatric IV assays, we want an easy access to the vessel, right? But as a dermatologist, it's the opposite way. Here, you can see that the blue is the bevel up. The first to enter the vessels of the blue is bevel down. The first to enter the vessel of the bevel down is less than the bevel up. And the lumen of the vessels is more in the bevel down. So from this information, we can make it in the opposite way of the pediatric IV access because we do not want to enter the vessel, right? And this is after the treatment. I have combined the hyalase antibiotics, IVs, mayors, and also the anti-aging treatment like antioxidant, and also do the omega-3 and ginkgo to improve the circulation. Also, vitamin C seems to improve the immune system and also promote the healing. Because you know this case, she is a very stubborn patient. She smoked 3 packs of cigarette per day and do not stop smoking. And you know that smoke is a very great enemy for the ischemia. So this is the result of the holistic treatment. And in this case, I think some of you may think that this is only the bruising. Okay? Sometimes we have a hard time differentiating from the vascular complication and just the bruising. But for this case, I insist that it had a combination part of the bruising and the vascular complication, not just the bruising alone, and I have a proof. Normally, for the hematoma, it takes at least days to weeks to recover, right? But this is what happened. The discorrelation getting better within a few minutes. So this is not hematoma alone. And also the pain of the patient getting better within a few minutes. And this case is similar to this one that has been published in the literature. So interesting point from this case, for the discorrelation, and it can be like just the bruising or vascular complication or combine both. So high index of suspicious is very important. The close follow-up is very important. And also, the keyword is being gentle when you do the procedure. Because it traumatizes to the tissue, if anything wrong happens, you can observe it easier. And this is the phase of the vascular complication. From the libido phase to the demarcation phase and the demarcation with scar. But earlier to detect is better. So right now, does any one of you have decided to quit injecting? Because that's a lot of complication. And also, for the bacterial complication, it's very common. You see, this is the real case. She injected the forehead for half a year and has been referred to me. I treat all the infection, remove all the abscess, and you can notice here there is the osteolytic lesion on the bone. So this can cause a problem to the bone also. And this problem happens around 3 months after the treatment also. I treat her with the proper drainage, boost her immune and proper antibiotics, and this is the result about 2 weeks after. And this one, the irregularities come from the superficial placement of the product is another problem. This is the same case, you can see the irregularities, and also inappropriate facial design is the problem. If you do not design the patient to have a proportionate curve, too much and disproportionate forehead can make the patient into the goldfish, and the chin like this can make the patient into the rich chin. And this one is a terrible case. This patient have paid $6,000 to have the fillers injection in this area, but the result is like this. So this is the point I want to focus. Do not push your practice with greed. Push it with your integrity. Just put the appropriate amount of the fillers at the right place. Do not put too much just because of the money. An interesting point for all this case is the X, Y, Z injection consideration when you have the injection. Normally, most of the injectors consider only the X and Y. You know where you inject, but you do not know how deep you are in. So it can cause a complication from that point. So always X, Y, Z consideration. And 360-degree evaluation is very important. Like this, when you evaluate a patient, you have to evaluate in every single angle and also at the static position and in dynamic position also. Especially when you want to treat the structure in the midline, like ear, nose, forehead, chin. Because the urge happen in the midline is very obvious, it's unforgivable. This is another case has been referred to me. She has been treated with her periorbital fillers within 1 month. And then after she has a diarrhea, this comes up, the tingle and edema in the right eye. She has been treated with her antibiotics and hyalase. However, the next day, the left eye bumps up. Okay. However, after that, after I treat with the proper hyalase and also the antibiotics and boost her immune system with all the supplements and IV, she's getting better. And 1 month after, I inject her also the FA, and it is all okay, no problem anymore. In this case, you can see this, the swelling and redness happens after a few hours after this patient has the dental procedure. Okay, so I treat this case with the antibiotics and okay, everything is fine. The interesting point from this case is when you do the superficial injection, do it correctly and do it with the only appropriate amount. If you inject superficially too much, it will cause the problem of the visibility and also the sagging in some area.
Just 1 minute.
Okay. And for the injection, the bacteremia and immune imbalance can cause the problem. Because you know, most of the cases have been reported to me that they have the diarrhea or some sickness, and after that, a few days or a few hours, the inflammation happens as their fillers. So this is the management, the overall management, the vascular management, and for vascular complication, hyalase and time is the key. Because for the retina, the golden period is only 1 to 1.5 hours. And okay, the prognosis for the blindness is not good, so prevention is the key. Slow, low pressure injection. Consider cannula. Aspirate before injection, small size, small needles. And you may consider premix with the adrenaline. And also be careful when anyone have undergone surgery, accident, and congenital defect. So this is my last slide. Always know these 3 to know strategy checklist before you have done any procedure. You have to know the problem of your patient, the anatomy and physiology knowledge. You have to know the product, its property and its risk. And also you have to know yourself, your knowledge and technique and skill, your strong point and your weak point. Okay, and this is my last slide. Thank you so much.
Thank you. Thank you so much for this excellent presentation. Thank you so much. Now it's my great pleasure to introduce my co-chair, Irina Ismailova, dermatologist from both Germany and Russia, in Moscow and in Germany, in Hamburg, in one of the clinics of Dr. Sadler. So we're curious to hear what you're going to tell us.